Since we're moving on to Arvind Ramesh, who's he just joined Lisa Mikowski's lab after graduating from Rice a few months ago. So take it away.
Thank you. Good afternoon, everyone. My name is Arvind Ramesh, and I'm a research technician in the laboratory of Dr. Liza Mikowski. And I'm excited to present on striking survival outcomes after vertical sleeve gastrectomy bariatric surgery in different strains of mice. So obesity is a multifaceted, devastating pandemic that can lead to further systemic complications such, I
guess Zoom is not, yeah. There we go. I guess your full screen's fine too. Yeah, now it's working? Okay. Great.
Sorry about that. So obesity is a multifaceted, devastating pandemic that can lead to further systemic complications such as cancer, cardiovascular disease, and diabetes. So the criteria for one to be considered overweight is having a body mass index of above 25. And for one to be considered obese, the criteria is having a BMI at or above 30. And as you can see, developed countries such as the United States, Australia, and the UK lead global statistics in obesity incidences. And with the distribution of obesity across the world, we can see that there is a higher incidence of obesity in more developed countries than underdeveloped countries. So to manage obesity, lifestyle changes such as increase in physical activity and diet modifications, as well as pharmaceuticals and surgery, all exist to treat obesity. And of these different treatment forms, bariatric surgery yields the best sustained weight loss. And vertical sleeve gastrectomy, or VSG, is the most common type of bariatric surgery, shown here highlighted in red, where the stomach's physical capacity to store food is restricted. And this leads to increased gastric emptying and hormonal changes. And a study published in 2020 comparing groups of bariatric surgery patients with control patients, we can see a drastic weight loss effect immediately after bariatric surgery with a sustained weight loss effect across the 20 years of follow-up. So in preclinical models to investigate obesity, laboratory mouse strains are used, but there are issues with the current use of these strains. For example, over 90% of the studies only use male mice, and the methods to perform bariatric surgery and VSGs are unclear, which leads to a lack of reproducibility. So this ultimately drives the need for a higher precision in these procedures of VSG and bariatric surgery. And this matters because VSG incidences are rising as the preferred surgery in patients. So we can see from 2008, there has been a steady increase in the incidence of vertical sleeve gastrectomy. And since 2013, the rates of vertical sleeve gastrectomy have actually surpassed the gastric bypass surgery. And so VSG procedures need to be further investigated in preclinical mouse models. So in our study, we have created such a standard of VSG operating procedure. We have also investigated pre and post-operational procedures as well. And we have used these procedures in two different laboratory strains of mice, first being the C57BL6J or B6 mouse model shown here, and the FEB-NJ FEB model shown here down below. And we have monitored the acute and long-term survival post-VSG procedure, the acute period being 5 weeks after the VSG procedure, and the long-term survival being after 5 weeks. So for the pre-operational procedure, 12 hours prior to surgery, we kept the high-fat diet in the mouse cage and added an diet gel recovery gel cup and an Ensure nutritional shake to supplement the high-fat diet. And 4 hours prior to surgery, we transferred the mice to a new cage and removed the high-fat diet, but we kept the gel cup and the nutritional shake as a liquid-based diet is easier to clear out from the stomach during the VSG. During the time of surgery, we removed the abdominal hair using Nair and placed the mice in a Somnosuite anesthesia induction chamber. And once we transferred the mice over to a nose cone shown down here, we anesthetized the mice using different analgesics administered both subcutaneously and intradermally. And we disinfected the abdominal region using a betadine antiseptic solution. So for the procedure, after the opening of the abdominal cavity and isolation of the stomach outside of the cavity, we removed a portion of the mouse's stomach shown here along the greater curvature of the stomach's fundus, as well as cutting the connective tissue around the stomach. So this greatly reduces the physical capacity of the stomach to a size approximately of this nature, and closure of the abdominal cavity finishes out the VSG procedure. For the sham procedure, there are two important differences between this procedure and the VSG. First, of course, no stomach tissue was removed, and also neither the pancreatic nor the splenic arteries were ligated. These two arteries were ligated in the VSG to prevent excessive blood loss during the procedure, but in the sham procedure, these two arteries were not ligated. And for the post-operative procedure, warm saline was immediately administered subcutaneously to the mice, and we reintroduced the high-fat diet as well as the gel cup and the nutritional shake, and administered carprofen subcutaneously 24, 48, and 72 hours post-surgery. The Black 6 mice showed 100% survival during the acute survival period of 5 weeks, as well as the long-term survival period after 5 weeks. These mice not only had a drastic weight loss effect immediately after VSG, shown by this red line here, but they also sustained their weight loss during the acute survival period and even past 5 weeks. And we observed no acute issues during these 5 weeks or even after the 5 weeks of VSG. For the FEBN mice, we observed actually a drastic difference in survival and issues post-VSG, both during the acute and the long-term survival period. We saw that only 36% of the FEB mice survived up till 5 weeks, and there was an acute survival problem where 5 of the mice died within the first 3 days of VSG, shown in this graph here. And we also observed a long-term survival problem where 40% of the mice that survived 5 weeks or more developed bezoars, which are these large engorgements of the stomach. And once cut and opened up, we see that these bezoars contained mixtures of food and indigestible materials such as bedding and hair. And what we also observed is that these mice had a poor weight loss effect. In fact, the FEBN mice began the study much leaner compared to the weight loss that was observed after the VSG itself. And we're currently collaborating with the Mouse Metabolic Phenotyping Core at Vanderbilt to investigate why it is that the FEBN mice have such poor weight loss outcomes and survival issues after VSG. So again, there is a need for a standard reliable VSG protocol that will allow for a greater ease to study obesity in preclinical mouse models. And we have defined a VSG procedure that was performed on both B6 and FEB mice, both obese. Survival analysis again showed that the B6 mice have sustained weight loss post-VSG with a 100% survival rate. But the FEB mice do not have adequate long-term post-VSG survival, with a 0% survival rate accounting for the long-term survival period after the VSG. For future steps, we're going to investigate the gut microbiome changes and the immunity changes in these mice, both before and after the VSG. To study immune function, we intend on collecting small intestinal Peyer's patches, shown as these white modules here. And these Peyer's patches are part of a collective gut-associated lymphoid tissue, or GALT, that is found in animals, including humans. And to study the gut microbiome effects, we are planning to isolate contents in the jejunum and cecum of the small and large intestines of the mice, as shown here. So I'd like to thank the Mikowski Lab, especially Maggie Bohm and Sydney Joseph, for assisting with the VSG procedures, as well as Laura Sipe, a previous postdoctoral fellow, performed a lot of the VSGs in the study, as well as Dr. Brianne Hibble, the attending veterinarian whom we consulted during the VSGs, both pre and post-operational. Thank you, and I will now take questions from the audience.